looking at creating computer systems, computer intelligence really, that can solve problems and do tasks, sort of like mimicking human thinking.
Okay.
The main goal is to radically improve how we treat patients, how we diagnose conditions. It's about building algorithms that can, well, emulate our own analytical skills to systematically figure things out, deduce information.
So it's about giving medical professionals better tools.
Powerful tools, yeah, exactly. Putting these powerful tools right into their hands.
Okay, great. So let's unpack this then. I think one of the areas that gets people most excited is diagnostics, right?
Yeah.
Making diagnoses faster, more accurate, especially with medical imaging.
Oh, absolutely. That's a huge frontier.
It really feels like it's changing how doctors can see, quite literally, and understand health conditions, sometimes with just incredible precision.
It really is fascinating. What AI algorithms can do is analyze just enormous amounts of data from these medical images. We're talking vast data sets. And they find these really complex patterns, things that, honestly, even a very experienced human eye might just miss sometimes. It significantly enhances what doctors can do across pretty much all types of imaging.
So it's not just about being faster, it's actually seeing more.
Seeing more and seeing it more clearly. That's a good way to put it.
Okay, so where should we start? Maybe cardiovascular imaging. Heart disease is still such a major issue globally.
Yeah, that's a perfect place to start. It's a massive area for AI development. So take echocardiography, for instance. That's the non-invasive ultrasound of the heart.
Right.
AI is proving incredibly valuable there for diagnosing and treating cardiovascular diseases, CVDs. It gives these really precise quantitative evaluations, numbers, measurements.
How precise are we talking?
Well, get this. One study showed an AI model with 97.8% accuracy just in identifying the different views in an echocardiogram. You know, the different angles they capture.
Wow, 97.8%. How does that compare to, say, a human expert?
That's the kicker. Expert human echocardiographers. Their accuracy in identifying those same views is typically somewhere between 70.2% and 84%.
That is a huge difference.
It really is.
So that could mean catching subtle heart problems much earlier. Or more consistently, maybe. Things that might be missed otherwise, maybe due to fatigue or just the sheer volume of images.
Exactly that. Earlier detection, more consistent reads. It could potentially save lives by flagging problems before they get serious or before they're overlooked.
Okay, that's echo. What about other big imaging techniques like MRI and CT scans?
Yeah, they're getting the AI treatment too. For magnetic resonance imaging, MRI, particularly cardiac MRI, AI helps improve the 3D visualization. It makes it easier to spot disease patterns.
Especially in tricky spots.
Precisely, like the right ventricle of the heart, notoriously difficult to see clearly in standard 2D images. AI helps build a much better 3D picture.
And CT scans? I know they involve radiation, so is AI helping there too?
Definitely. With cardiac computed tomography, CT, AI assists in diagnosing coronary artery disease, CAD, and also in predicting the risk of atherosclerosis, that hardening of the arteries.
Okay.
But what's also really important is safety. AI is helping make low-dose CT scans safer and more effective. It can sort of intelligently reconstruct the images from a low-dose scan, boosting the quality up to the level of a regular dose scan.
So patients get less radiation exposure.
Exactly. Significantly less exposure, but without sacrificing the diagnostic quality. That's a major win.
Right.
And it's not just complex imaging either. AI is also being applied to automatically spot heart problems directly from electrocardiograms, ECGs.
The standard ECG trace.
Yep. Finding abnormalities automatically.
So AI isn't just helping us see better, it's also making the tools we already have safer, more efficient. That's really interesting. Does this real-time insight extend beyond static images? Like, what about imaging that happens live during a procedure?
Oh, absolutely. That's where things like angiography imaging and intravascular imaging come into play. Think imaging inside blood vessels.
Like during procedures like angioplasty.
Exactly. AI can speed up the diagnosis and interpretation of those images, often in real time. What's really advanced is its ability to combine data from different types of intravascular imaging, like IVUS, which is ultrasound inside the vessel, and OCT, optical coherence tomography.
Combining them.
Yeah, into a single unified view.
Yeah.
This gives doctors a much faster, more thorough look at damaged vessels right then and there. It really streamlines the whole process.
Okay, fascinating. Let's shift gears a bit. What about bones and joints? How is AI impacting orthopedics? Seems like another area where imaging is key.
It absolutely is. In orthopedics, you have AI models now that can automatically detect bone fractures from x-rays.
Just spot them automatically.
Yeah, and not just spot them, but also classify them quite precisely using neural networks. So it can tell you if it's a stable fracture, an open or compound one, transverse, oblique, comminuted, all the different types. Green stick, spiral fractures too.
That level of detail immediately, that must really help with planning treatment.
Dramatically. Knowing the exact type of break right away informs the entire treatment plan. And it's not just fractures. For bone cancer, AI systems are being developed to help distinguish between malignant, cancerous tumors and benign ones.
Helping with early detection.
Crucial early detection, yeah. Which, as you know, is absolutely paramount for successful cancer treatment.
And are there other tools emerging beyond just image analysis?
Yes, definitely. We're seeing AI-based outcome calculators. These tools can help predict surgical risks for individual patients.
Like the chances of complications.
Exactly. Or things like predicting the likelihood of delirium after hip fracture surgery, or even estimating survival rates before surgery for patients with metastatic cancer that's spread to the spine or limbs.
Wow, that's moving towards really personalized surgical planning, tailoring things very specifically.
That's the goal. And it can also help in optimizing resources and potentially reducing healthcare costs by identifying risks early.
Okay, let's move to another complex area, ENT or otorhinolaryngology, ear, nose, and throat. That covers a lot of ground.
It really does. And AI is making inroads across the board. In audiology, for hearing, AI methods are making it easier to diagnose hearing loss. They can automatically group certain test results, like auditory brainstem reactions, and they're enabling online hearing tests, too.
Making hearing tests more accessible.
Potentially, yes. And AI can even help fine-tune hearing aids. It evaluates the sound environment, the soundscape, to improve the speech-to-noise ratio, making it easier to hear conversations.
That's clever.
And get this, some research is exploring AI to interpret spoken language directly from brain activity, from the cortex. This could be huge for people with conditions like anarthria, where they can't physically speak, but their brain is forming the words.
Wow, interpreting thoughts into speech. That's incredible. What about the ENT otology? The ear itself.
Right. For otology, there's AI-powered software, like one called Otoscope, used in computer-assisted image processing. It looks at images of the tympanic membrane, the eardrum, and helps categorize them. Is it normal or abnormal?
Improving diagnostic accuracy.
Exactly. Especially helpful in telemedicine scenarios where a specialist might not be immediately available. It helps the initial assessment.
And the L-laryngology, the throat and voice box.
That's seeing some striking results, too. In laryngology, AI tools are combining speech recognition technology with images from video stroboscopy. That's where they use a flashing light to see the vocal cords vibrating.
Yep.
And these combined AI tools have achieved, almost 100% accuracy in diagnosing certain early-stage throat cancers, like T1A glottis cancers, and also identifying other vocal cord lesions.
Almost 100%. That is just astounding for something like really cancer detection.
It's remarkable. The pattern recognition capabilities are just phenomenal for these specific tasks.
Does that mean we're getting close to AI replacing human experts in these areas?
Yeah.
Or is it more like a superpowered assistant?
It's definitely more about augmentation, a very powerful second opinion, if you will. AI's precision is amazing for these defined pattern-based tasks, absolutely. But you still need the human expert for the broader clinical judgment, the patient context, the nuances.
Right, the holistic view.
Exactly. Which brings us nicely to pathology. This is really the backbone of so many diagnoses, looking at tissues and cells under the microscope.
Okay. How's AI changing pathology?
Well, pathologists now often work with digital images of tissue slides, not just glass slides. And AI is analyzing these digital pathology images to detect and characterize all sorts of cancers, often matching or sometimes even surpassing human accuracy.
For specific tasks again?
Yes, for specific tasks like identifying breast cancer signs on mammography or distinguishing different types of brain tumors from images. In image analysis and histopathology, AI helps interpret those really complex patterns you see in tissue samples.
Helping standardize things.
Precisely. Standardizing diagnoses and grading systems like the Gleason score for prostate cancer, and improving accuracy in things like cell counting, for example, counting tumor-infiltrating lymphocytes, which can be important for predicting treatment response.
So making diagnoses more consistent and potentially more accurate.
Yes. And here's another leap. AI is starting to predict molecular or clinical features directly from the pathology images themselves.
What do you mean, like genetics from an image?
Kind of, yeah. For instance, predicting if a glioma, a type of brain tumor, has a specific genetic marker like an IDH1 mutation just by analyzing the standard pathology slide image. This could potentially reduce the need for separate, sometimes invasive molecular tests.
So the image itself holds clues that AI can unlock.
Exactly. It's finding correlations invisible to the human eye. When we talked about sensitivity and precision earlier with brain tumors, high sensitivity means the AI is great at finding the cancer when it's there. High precision means it's great at not calling healthy tissue cancerous. You need both.
Got it. Okay, this diagnostic capability is incredible. But you mentioned earlier that AI is becoming more proactive. That leads us into monitoring and management, right?
Yes. And here's where it gets really interesting, I think. AI is making healthcare way more proactive, much more personalized. It's almost like it can follow you, metaphorically speaking, wherever you go.
Beyond just that initial diagnosis.
Exactly. It's no longer just about finding the problem. It's about continuously tracking health, managing conditions, hopefully preventing issues before they escalate.
So how does that work? Is this where wearables and mobile tech come in?
Precisely. This is a critical shift. AI integrates really smoothly with mobile health, mHealth, and the Internet of Things, or IoT, all those connected devices.
Right.
This combination enables continuous monitoring, it improves how we manage chronic diseases, and it significantly boosts clinical decision-making. It's fundamentally shifting healthcare from being reactive to being predictive.
Okay, so let's talk specifics. Remote patient monitoring, RPM, and wearables. What kind of data are we talking about? And how is AI using it?
It's a huge range of data. Wearable sensors like smartwatches, fitness trackers, patches, they collect vital signs nonstop. Things like heart rate variability, which is a subtle measure of stress and recovery, heart rate recovery after exercise, blood pressure, even things like lung fluid volume indirectly, sleep stages.
And activity levels, I assume.
Yeah, detailed physical activity levels, steps, intensity, all of that. And AI algorithms analyze this constant stream of data.
To do what? Predict risks.
Exactly. These devices are proving invaluable for predicting risk for cardiovascular diseases, helping manage hypertension, supporting cardiac telerehabilitation programs.
So rehab from home, guided by data.
Pretty much. And think about smartwatches with built-in ECG monitors. Some can detect cardiac arrhythmias like atrial fibrillation, AFib, with really high accuracy. One study showed up to 99.62%.
99% accuracy from a watch detecting AFib. That's amazing.
It is. It means potentially catching a serious condition that might otherwise go unnoticed until it causes a stroke, for example, all without needing constant trips to the doctor.
And the IoT part. How does that fit in?
The Internet of Things enables these RPM systems to work seamlessly. Data flows from the wearable, often via a smartphone, to a secure cloud platform where AI can analyze it. This allows for continuous, real-time monitoring, whether the patient is in the hospital or, more often, comfortably at home.
That sounds incredibly empowering, especially for people managing long-term conditions. Are there specific chronic diseases where this AI-driven monitoring is really making a difference right now?
Absolutely. Several areas stand out. Take diabetes, for instance. AI prediction models can help categorize the type of diabetes, and based on real-time glucose readings from continuous monitors, they can provide automated dietary suggestions or even recommendations for insulin therapy adjustments.
Personalized advice in real time.
That's the idea. For dementia, it's fascinating. AI algorithms combined with computer vision cameras and sensors in the home are used in smart home setups.
To watch over people.
To observe and assess daily activities, yes. Things like hand-washing routines, determining if a prompt might be needed, tracking sleep patterns very accurately. And these smart home systems are showing real results.
Like what?
Things like helping individuals with dementia regain urinary continence or significantly reducing instances of nighttime wandering. It boosts their autonomy and quality of life and gives peace of mind to caregivers.
That's incredible. What else?
Well, migraines. AI-powered mobile health apps are using big data algorithms. They analyze triggers, symptoms, environmental factors, aiming to build precise predictive models.
To warn someone a migraine is coming.
Exactly. The goal is to notify patients before an episode hits, giving them a chance to take preventative medication or make lifestyle adjustments. And for heart failure, that wearable data we talked about, activity, heart rate, HRV is crucial for risk stratification. It helps doctors pinpoint which HF patients are at higher risk of, say, needing hospitalization.
It really sounds like AI is becoming this vigilant health guardian, extending into really critical, fast-paced environments, too, like the ER or the ICU.
Definitely. The stakes are incredibly high there, and AI is starting to play a significant role in emergency medicine and ICU monitoring.
How so? Predicting crises.
In a way, yes. AI models can predict the likelihood that a patient coming into the ER will need critical care, like needing ICU admission, or, unfortunately, their risk of in-hospital mortality.
Based on their initial vital signs.
Yes, by analyzing vital signs and other data very quickly. For instance, some machine learning techniques can classify the near-term risk of mortality. One study showed a predictive accuracy of 98.8% for cardiac arrests, specifically the negative predictive value.
Meaning it's very good at saying, no, this person is not out to have a cardiac arrest.
Exactly, which is incredibly useful for ruling things out quickly and focusing resources. AI can also help forecast overall emergency admission numbers or categorize patients by risk level right when they arrive, helping hospitals manage patient flow and resource allocation better.
And inside the ICU itself.
Inside ICUs, AI is used for things like predicting short-term mortality risk for patients with very serious conditions like cirrhosis, and developing really personalized models based on a patient's specific vital sign trends over time.
Wow. And all this data from wearables, from the ER, from the ICU, it must be feeding into making clinical decision support systems, CDSS, much smarter, right? Helping doctors make better calls.
Precisely. That's a key application. AI significantly enhances these CDSS tools. It chews through massive data sets from electronic health records, EHRs, combining it with real-time data perhaps to forecast things like emergency admissions or provide super timely information right when a doctor needs it for a decision.
Can it predict things like readmissions too? That's a big cost issue.
Yes, it can. AI models are being trained to predict the likelihood of a patient being readmitted to the hospital within a certain time frame, say 30 days. Identifying those high-risk patients allows hospitals to intervene, maybe with better discharge planning or follow-up, potentially preventing those costly returns.
That makes sense. You mentioned something earlier, facial and emotional recognition. How does that fit into clinical support?
Yeah, it's an emerging and perhaps slightly controversial area, but fascinating nonetheless. AI is being developed for facial and emotional recognition in clinical settings. The idea is that systems could potentially classify patient emotions like pleasure, anger, sorrow, just from analyzing facial characteristics.
With what kind of accuracy?
Some systems are reporting up to around 83–84% accuracy. The potential application is maybe understanding the well-being of patients who can't easily verbalize their feelings, perhaps due to dementia or other conditions. It could offer another layer of insight, but obviously needs careful ethical consideration.
Absolutely. Okay, so AI is diagnosing, monitoring, predicting. But what about actually doing? Assisting in procedures. You mentioned surgery earlier.
Yes. So what does this all mean, right? AI isn't just, watching and predicting from the sidelines. It's becoming an active assistant, even in the operating room. And it's helping tailor care to incredibly specific needs. This feels like a really significant leap beyond just diagnostics and monitoring.
It does. It feels like the next level of integration.
This is where AI really expands its scope, I think. It's profoundly enhancing surgical precision, helping to reduce errors, offering these tailored approaches, and its reach is extending into fields you might not immediately think of, like dentistry or even maternal care, revolutionizing procedures and patient outcomes across the board.
Okay, let's start with the OR then. Intelligent robots in surgery. That definitely sounds like science fiction becoming reality. How are they moving beyond just human limitations?
It absolutely is becoming reality. You have surgical robots, and the Da Vinci system is probably the most well-known example, right? These robots are designed specifically to reduce sources of human error. Think about natural hand tremors or fatigue during long operations. They also allow for minimally invasive procedures, which means less trauma for the patient.
How does AI fit in? Does the robot learn?
Yes, AI is crucial. The systems study and can even mimic the surgeon's movements with enhanced precision and stability. This leads to potentially greater success rates and definitely safer outcomes. AI supports the applications of these robots in all sorts of complex procedures, things like hysteromyoma resection, removing fibroids, or really intricate cardiac interventions.
Okay. And for something incredibly delicate like brain tumor surgery, the precision needed there is just In math.
Absolutely critical. And AI is playing a role at literally every single stage.
From start to finish.
Pretty much. For preoperative planning, you have AI algorithms, some using natural language processing, NLP, that can actually interpret the text of an MRI brain scan request from a doctor.
Read the request.
Yeah, and then suggest or select the optimal imaging sequences needed for that specific case, sometimes even outperforming radiologists in selecting the best protocol. These AI tools can also predict survival outcomes for patients with certain central nervous system tumors, and even assess how likely it is that a tumor can be fully surgically removed its resectability. Gives the surgeon a much clearer roadmap before they even start.
Okay, that's planning. What about during the surgery, the intraoperative workflow?
Right in the OR, AI programs can accurately outline the tumor boundaries and map nearby anatomical features, even if the brain structure is distorted by the tumor or the surgery itself.
Real-time guidance.
Essentially, yes. And crucially, some AI systems can differentiate tumor tissue from healthy brain tissue in real time during the operation. They use techniques like analyzing hyperspectral digital images taken during surgery.
How accurate is that differentiation?
Incredibly accurate. Studies are showing high sensitivity, again, that's finding the tumor when it's there, around 97.5%, and very high precision, not misidentifying healthy tissue, around 98.5%. That helps the surgeon remove as much tumor as possible while sparing healthy tissue.
That's game-changing for outcomes. And after the surgery, post-operative care.
AI steps in there too. It can analyze a whole host of medical data, pre-op info, intra-op details, early post-op signs to predict the likelihood of complications. Things like surgical site infections, SSIs.
Predicting infections.
Yes, and with significantly higher accuracy than conventional risk scoring methods. One example showed AI predicting SSIs with 95% accuracy compared to about 62% for traditional methods. Early warning allows for quicker intervention.
That's truly comprehensive support for such a complex procedure. Okay, let's pivot completely. What about pregnancy? That whole journey from conception through delivery has so many variables and potential risks.
It really does, and AI is being applied across that entire spectrum. For general maternal and fetal health, AI algorithms are analyzing data from loads of sources, electronic health records, readings from medical equipment during checkups, even data from patient mobile devices or wearables.
We get a bigger picture.
Exactly. A more comprehensive understanding of both the mother's and the fetus's health status. This includes predicting critical risks much earlier, like the potential for developing preeclampsia or gestational diabetes mellitus, GDM.
Early warnings again.
Yes. And in the realm of assisted reproductive technologies, ART, like IVF, AI is being used too. It helps predict the chances of a successful pregnancy resulting from an IVF cycle. Some models show up to 60% accuracy there. It can also help assess the risk of miscarriage based on early data.
Giving potential parents more information for incredibly tough decisions.
That's the hope. AI also assists generally in disease screening and management throughout the pregnancy, often integrated into those clinical decision support systems we talked about earlier.
And what about the actual labor and delivery process?
There are some really interesting applications emerging there too. For example, using ultrasound images, AI algorithms have been developed that can recognize the optimal spot on the lower back for administering epidural anesthesia.
Finding the sweet spot for the epidural.
Essentially, yes. Achieving a reported 93% success rate in identifying the best location, which can make a huge difference for effective pain management during labor.
Wow. Okay, so from brain surgery to childbirth, AI's reach is incredible. Let's talk about dentistry. It often feels a bit separate from mainstream medical AI discussions. Is it making inroads there too?
Oh, absolutely. Dentistry is seeing some really significant impacts. In orthodontics, braces, and alignment, AI can simulate facial changes before and after treatment, giving patients a preview.
See the results beforehand.
Sort of, yeah. It also improves the identification of key landmarks on cephalometric x-rays, those profile skull x-rays. Sometimes AI does it even better than human examiners, and it can rapidly segment teeth and the surrounding alveolar bone from scans.
Oh, rap.
We're talking like 500 times faster and potentially 300 times more accurate than a doctor doing it manually. Huge time saver, much more precise planning.
Okay. What about other dental areas?
For oral and maxillofacial pathology and surgery, similar to general pathology, AI is used to help detect tumors and cancers from dental x-rays and microscopic images. And robotic surgery, guided by AI, is showing enhanced precision in procedures like placing oral implants.
Robots for implants.
Okay.
And fillings or root canals,
All right.
prosthodontics and endodontics.
Yep. AI assists in designing crowns, ensuring a good fit. It helps detect subtle signs of infection around the root tip, those periapical radiolucencies on X-rays. And it can even help determine the accurate working length needed for a root canal treatment.
More precision, better outcomes, hopefully.
That's the aim. And teledentistry is benefiting too. Just like teleotoscopy for ears, AI can enhance remote dental assessments, providing faster initial evaluations and helping general practitioners decide when referral to a specialist is needed, especially valuable in areas with limited access to dental specialists.
All right, bridging access gaps. Okay, one more area from our outline. Elder care. This is such a huge and growing need globally as populations age. How is AI transforming care for older adults?
It's a really vital area, and the focus is very much on enhancing quality of life, safety, and autonomy for older individuals. Robotic assistance is one key component.
Robots as companions?
Sometimes, yes. You have things like PAR. It's a therapeutic robot designed to look like a baby seal. It's interactive and has been shown to be quite effective in alleviating depression and loneliness, particularly in care home settings.
A robot seal. Interesting.
Yeah. And other robots are being developed to provide cognitive games, deliver medication reminders, actively monitor health signs, all designed to help elderly individuals age in place safely and comfortably in their own homes for longer.
Supporting independence.
Exactly, and that ties into smart home systems as well. AI integrates with all those IoT sensors and devices within a smart home environment.
To provide monitoring and assistance.
Continuous monitoring and timely assistance, yes. This is improving autonomy, even for residents in care facilities. We mentioned the dementia examples earlier, improving continence, reducing wandering, but also things like increasing overall sleep duration by managing the environment better. It fundamentally enhances their daily lives and safety.
It really feels like we've covered so much ground.
Yeah.
This deep dive, it's just revealed this incredible breadth of AI's influence.
Yeah.
Right across the healthcare spectrum, from the very first moment of diagnosis through ongoing care, monitoring, and even into these really complex surgical procedures.
Yeah, it's truly changing just about everything in how we approach health and medicine.
The scale is just...
It really represents a profound shift. AI isn't just, another piece of technology. It feels more like a fundamental move towards care that is much more precise, more efficient, definitely more personalized, and hopefully more accessible too. It provides this invaluable assistance, right? And these powerful insights that come from processing just immense amounts of data. Things humans just couldn't process on that scale or speed. But, and this is crucial, it remains a supplementary tool.
Right. It augments, it doesn't replace.
Exactly. It augments the absolutely indispensable expertise, the judgment, and perhaps most importantly, the empathy of human healthcare professionals. It can help bridge that gap between, say, theoretical knowledge and practical application in complex cases. It provides a kind of roadmap, really, for both patients and for doctors navigating these increasingly complex health landscapes.
A roadmap. I like that. So as AI continues to learn, continues to improve from all this data it's processing, building ever more detailed roadmaps for healthcare. It makes you wonder, doesn't it? What new frontiers are we going to see? What happens when human ingenuity and that essential human compassion really collaborate seamlessly with this powerful artificial intelligence?
The potential seems vast.
And maybe the final thought for everyone listening is, how do we make sure that this powerful alliance, this collaboration between human and machine intelligence, truly benefits everyone, everywhere, and leads to genuinely better well-being for all?